Inside the stories that affect you. This is Inside KELOLAND.
Good evening. Thanks for joining us for this special edition of Inside KELOLAND. Sioux Falls police are dealing with drug investigations on a daily basis. Minnehaha County deputies are responding to more opioid overdoses than ever before, and people from all walks of life are ending up in court. We are in the middle of an opioid crisis. I felt it firsthand. My daughter Emily died of fentanyl poisoning in May. Since her death, the problem has only gotten worse. It's a situation where everyone needs to come together.
Our churches, our nonprofits, our healthcare providers, our community, our citizens, all need to get in this together because we will not win this alone.
Coming up, we're sitting down with representatives from Sanford and Avera Health to talk about what's being done today and what needs to happen in the future. But first, whether it's heroin or OxyContin or hydrocodone, it's all highly addictive and can be deadly. The death rate involving these drugs has quadrupled since 1999. Tonight, we're showing you some of the faces of addiction. 25-year-old Kristen Bernard was an artist who also loved to write and read books. But she started using drugs 10 years ago when she was just a sophomore at Lincoln High School. It began with cough syrup and progressed to prescription pills.
The kids in school take their parents' medications, so I know that there was a lot of prescription drugs that other kids were bringing.
As the years passed, Leanna Bernard helplessly witnessed the disease of addiction take hold of her daughter.
She'd walk in and she wouldn't be able to stand. She didn't know where she was. And I knew at this point she was using needles, and I didn't know that for a while. And that she was being reckless with her life, and I didn't understand why.
Bernard desperately tried to get Kristen into a treatment center.
We didn't have insurance, and a lot of them, like one in particular I spoke to, it was, they wanted, $5,000 right away. That's not something we had. I spent 2 days on the phone. The best thing I could do at the time was get her into the methadone clinic. It was easy, it was cheap, and we did really good for about 1.5 years.
But less than 2 weeks after being weaned off methadone, Kristen was back on opioids and other drugs. Leanna sent her away to Alaska to visit her dad, but instead of helping the problem, Kristen got worse. When she returned home, Leanna knew she had to do something drastic.
So I got her to the hospital where they had her checked out. I had her into detox.
Leanna says she begged for help.
Like, if somebody doesn't help me, she's going to die. Like, straight up, she's going to die. They said, well, we're going to get her into a 90-day program, and by the time she was released out of detox, they didn't have any beds open. They sent her home.
That was just last spring. Leanna felt all alone in the fight for Kristen's life.
I can imagine a lot of parents doing what I do, where you just sit home and you go check on them to make sure they're breathing. You chase people out of your yard. I mean, it's a battle. It's literally a battle. And there's, unless somebody has room or the means to bring them somewhere where they can be kept and helped, then there's nothing you can do.
Not enough treatment facilities, not enough methods or providers to do the identification and to properly get people into treatment. And so put all of those things together, and a mother or father looking to put their child into treatment, their options are pretty slim.
Face It Together recovery coach David Whitesock says cases like Kristen's are becoming all too common.
If you look at all of the people, especially the young kids in their 20s, who have overdosed and died, there were a lot of different signs, but they just weren't recognized at the right time.
I kept her home because I thought if I kept her here with me, she'd live longer and that I could help her. Didn't work.
Then one day, when Bernard went to work, Kristen took off with a new boyfriend.
And they had gone over to, I guess, what's known as a drug house here in town. And when I got to work Friday, an officer come to my work and But we knew that she had been found dead at that house full of people.
Bernard realizes that some may write her daughter off as just another junkie, but she remembers the little girl who loved unicorns, fairies, and playing pretend.
At some point, she wanted to work with dolphins. She wanted to write. She could have done and been anything.
Do you feel like she was robbed? Do you feel like you were robbed?
Damn right.
It shouldn't be happening. And so how do we solve that problem? How do we change that problem so that people aren't dying? That's a hard question.
A question that Bernard hopes her daughter's death can at least prompt more people to ask.
She was a good girl. She had one major problem, and we fought that problem the best that we could. And we lost.
Kristen and her family are not alone. More people are feeling the effects of the opioid crisis. Up next, we're going to hear from the medical community. And later, we'll introduce you to a woman who not only lost her mother to the crisis, she also lost her young son. Welcome back to this special edition of Inside KELOLAND. We're dedicating the entire half hour to the opioid crisis. To give you an idea of just how addictive these drugs are, 1 in 4 people who are prescribed opioids struggle with addiction. The number of deaths has steadily increased since 2012. We are now joined by Dr. Dan Heineman of Sanford Health and Malia Holbeck with Avera Behavioral Health. Thank you both for being here.
Oh, you're welcome.
Thank you. Maybe one of the first things we can talk about is, the high addiction rate. I think I've heard something like it can take 7 days to become addicted to opioids, and Sanford is trying to do something to cut down on the prescriptions.
Well, and that's true, and it varies from individual to individual how quickly you can become tolerant and then dependent and then addicted. So we're really trying to, as a policy for all of our providers, to reduce the number of prescriptions, short prescriptions. We're even going to start shortly into the new year looking at the number of morphine milligram equivalents we give out in an acute prescription. So we've done a lot of work with our surgeons. So we operate on you or you have a broken leg, those hurt. But we need to also then take and do a better job of, let's look at maybe 3 to 5 days, then reassess. Also, if you have some concerns about whether or not an individual might rapidly become addicted, let's do a preoperative evaluation or let's do an assessment with one of the opioid assessment tools that are out there to see if we need to be concerned.
I know one of the things that's part of the new Opioid Crisis Response Act is requiring drug companies to come up with alternatives to opioids for pain relief. That hasn't really happened yet, though, and I've heard from a lot of people, as I've been covering this story, who need pain medication, and they're very upset. They say they're having, more difficult time now. So what do you do about that patient that has the chronic pain?
Well,
it feels like it's being taken away.
It is being taken away, and they're going to feel that way. The CDC, in a lot of its guidance and a lot of its work, will tell you that patients who've significantly reduced the number of morphine milligram equivalents over a period of time really didn't notice any difference in their pain. What they're really probably responding to is the withdrawal that they're having from having been on those higher doses of an addicting opioid medication. So I think we need to do a better job of setting the expectations. I can control your pain. It's not going to be completely alleviated. We also are finding that many of our proceduralists are finding really good results with ibuprofen or Aleve, naproxen. Other Tylenol is another really good pain medication. So if you set the expectations, you go right at it early, and we say we're going to try to reduce the number of controlled substances we're going to put you on, and set that expectation, many times we can do a much better job without even putting somebody on an opioid.
Now, Malia, we've just heard Kristen Bernard's story, and it's just heartbreaking. And her mother has such a struggle, trying to get her help. Mm-hmm. Do you find that's a common theme, that people really do struggle, first of all, to get somebody into help, to get them the right kind of treatment, to help them stay sober? I mean, there's just so much. This is such a multifaceted problem.
It really is, and we do see that family members really do struggle with being able to know what to do. I think there's just not a lot of education out there of what to do with individuals that are struggling with addiction. And one thing that I'd encourage family members to do is for them to reach out to help too and talk to a professional that would be able to help guide them and being able to help give them the skills and tools to be able to work with their family member and hopefully be able to get that family member the help that they need.
I wonder if I could get both of your take on addiction as a disease or substance use disorder as a disease, because you know about half the population doesn't believe it's a disease. So can you maybe explain to us why it is?
Well, from a clinical standpoint, it is a disease. These drugs affect your brain, and once your brain has been altered from these drugs, the brain seeks out and wants that continued alteration, if you will. And there are receptors within the brain, and individuals have different responses to it. But it is a disease. It is not a character flaw. It is not a weakness. It's not something that I can just easily take care of. It is a disease, and once we recognize that as a disease, then we recognize the importance of treatment and why, like any other disease, we need to go at it in a different way.
And Malia, why can't people just stop?
Yeah. So what I'll add to that too is, from Dan's comment, is it is a disease, so it's nothing that we can just fix or that is ever going to get cured.
It's a chronic disease.
It's a chronic disease. So just like diabetes, that would be something that is that would need to be taken care of ongoing. So just like recovery, that is something that that individual is going to have to take care of for the rest of their life and do some maintenance on for the rest of their life.
Okay. We don't have much time left for this segment, but you brought a couple of things with you. We want to explain what they are because people have been seeing them on the table here. It's important to get rid of your opioids that you're not using at home, right?
When you're done with your opioids, they need to go away. And you can either flush them down the toilet, which is an acceptable method.
But bad for the water supply.
Well, whether it's bad, it's detectable in the water supply.
That's what I've heard, that it shows up in the water supply.
So we've put a version of this in our clinics. If the pills go in here or a patch goes in here, they're rendered irretrievable. So it's a very safe way to collect the medications. Now, excuse me, if you go into the clinic, your clinician or nurse may actually ask you to put the pills in there.
Okay.
Because I can't take legal control of a controlled substance that's not prescribed or mine.
All right.
So I may ask you to count out your pills, and we both agree there's 20 hydrocodone tablets. Then I'd say, dump these in here, and then once this is full, we just throw this in the trash.
And that way they don't fall into the wrong hands.
It's DEA, FDA, and EPA approved. So it does
Thank you.
EPA approved.
It doesn't matter if you are rich or poor, young or old, anyone can be impacted by the opioid crisis. Meet a woman who has lost 2 loved ones when we come back. According to the National Capital Poison Center, this is actually the 3rd wave of the opioid crisis. The first wave began in 1991. The second started around 2010. A Sioux Falls woman was devastated by both of those waves. Brianna Lovis's childhood was less than ideal. This is the only picture she has of her and her single mom, Tracy. In 1990, when Brianna was 5 months old, she was riding in her car seat while her mom drove.
And she lost control on the gravel and flipped and rolled. She was ejected out of the window and landed on a barbed wire fence on her neck.
Tracy Lovis suffered nerve damage from the barbed wire, resulting in the loss of the use of her right arm. She also had her spleen removed. Brianna says her mother was in constant pain.
She was depressed just because of the way her life was, you know, she was disabled and she was sick all the time and she couldn't do the things that she wanted to do.
Brianna says her mother was also overprescribed opioid painkillers.
She literally carried around like a purse full of prescriptions.
Brianna says her mother's addiction to painkillers also meant she wasn't there for her as she grew up.
She would take them and then she'd lay on the couch and that would where she'd spent her day, is laying on the couch.
In 2007, Brianna gave birth to her own child, a boy whom she named Keyshawn, or Key for short.
And he changed my life for the better. He was fearless. He'd see a tractor bigger than me, and he wanted to climb it, he wanted to drive it, he wanted to know all about it. And dogs, didn't matter what size it was right there.
Brianna says Key knew his grandmother, but she was always hesitant to leave him with her because of her addiction. Then one day, she was in severe pain.
And I couldn't find anybody to watch my kid. So I called my mom. I'll never forget the day I dropped him off. Like, she was awake, she was fine, she was sitting there, she was watching TV, she was drinking coffee.
It turned out Brianna was having an appendicitis and needed emergency surgery. After 2 days in the hospital, she went home to recover, leaving 2-year-old Keyshawn with his grandmother.
But the day I dropped him off, I always told him, we don't say bye, we say, I'll see you later. And I said, all right, Key, bye-bye, Mommy, we'll see you in a little bit. And he looked at me and he said, no, Mom, not bye, it's later. And I had this feeling that I shouldn't leave him. I had this feeling that, like, that I should just bring him with me. And I told myself, you'll be okay. And that's the last time I see my son alive. The next morning, she awoke to a pounding on her door and was told Keyshawn was taken to the emergency room. And I just remember her saying, Keyshawn's not breathing.
According to hospital records, Tracy Lovis checked on Keyshawn that morning, but he was sleeping and would not arouse. She attempted to give the child coffee by mouth, including via syringe, and he was unable to tolerate this. She noted his breathing was odd and he was gasping.
My son overdosed on an 80-milligram Oxycontin.
80-milligram Oxycontin pill?
Yes.
Medical records say there are a host of medications in the house that he was staying at. Both the great-grandmother and the grandmother deny that he would be able to get in these, as they were locked up and they were with him most of the evening. But Keyshawn's urine test was positive for opioids.
That's what gets me, is like, if you didn't know, then how did my son have coffee in his lungs?
Tests show that Keyshawn was brain dead, and Brianna made the decision to take him off life support.
And I held him. So when they took him off life support, like, I held him like he's my baby. It was like the saddest, most peaceful moment of my life. It was weird. Like, I like felt him, like, be at peace. Like, I don't know. It was 1 minute, like, he just, like, his body got heavy, but the room got lighter. And that's how I knew that my son was gone.
Medical records show that Keyshawn's doctors were concerned about the possibility of child abuse in this case and contacted Sioux Falls police.
My mom would have been charged with failure to seek medical attention because she didn't call the ambulance, she didn't call the police, she didn't do any of the stuff that she was supposed to do. They pumped 4 cups of coffee out of my son's lungs.
For months following Keyshawn's death, Brianna pushed prosecutors in her son's case to file charges against her mom.
I just wanted justice for my son. They were charging my mom with negligent homicide and failure to seek medical attention. And the day that they were going to arrest her, they actually found her dead.
At just 36, Tracy Lovis' cause of death was oxycodone and a number of other drugs. She died nearly 4 months to the day of Keyshawn's death.
My family likes to say she died of a broken heart, but I know that she died the same way my son died.
Brianna says she couldn't cope and began using illegal drugs herself, although she steered clear of opioids.
And you paid a really high price.
Yes.
You personally.
Yeah.
Brianna has now been clean for 5 years and has a 4-year-old daughter named Sophie.
I feel like sharing my story with me losing my son could possibly help somebody with their addiction. Like, whether you get clean for your kids or for yourself, just do it. Like, it's worth it.
And she says talking about Keyshawn is part of her healing process.
Keeping his spirit and his memory alive really helps me.
Doctors, law enforcement, and lawmakers are all coming together to fight opioids. We'll look at the community response when we come back. A Sioux Falls lawmaker plans to introduce a bill allowing school nurses to provide Narcan to students. But as Perry Groten reports, some schools already have Narcan available.
Todd Runyon with the Sioux Falls Police Department is a familiar fixture roaming the halls of O'Gorman High School.
Try to be out in the hallway as much as I can, just to be a presence.
As a school resource officer, Runyon is a law enforcement link to students, as well as their friend, and if need be, a lifesaver.
It's always a fear. Kids are kids, that they make the occasional mistake.
Narcan, the nasal spray antidote that reverses the effects of opioid overdoses, is standard issue for all Sioux Falls police officers. That includes all resource officers.
We want to be able to have the tools to be able to counteract the overdose that they're experiencing at that point.
No resource officer has had to administer Narcan to any student at O'Gorman or Sioux Falls public schools. Runyon hopes that trend continues.
If I can go the next 5.5 years without ever having to use it, I'd be more than happy.
It's certainly very scary, especially having 2 young children. It's just frightening. It's all frightening.
Harrisburg mom Tiffany D'Agostino makes sure her 2 young kids know all about the dangers of drugs, including opioids.
My daughter is 5, my son is 8, and I already talked to them, don't do drugs. If anybody offers you anything, you run away. Run as fast as you can.
It was very
Sioux Falls State Senator Jim Stalzer says he plans to introduce a bill in the 2019 legislative session to specify that school nurses may also administer Narcan to students.
And it does no harm if the person is misdiagnosed and is given a dose and they don't have a drug in their system. It does no physical harm to them, so it's a very safe thing to administer.
I would like to know what the repercussions of putting that into a child's body and what would happen thereafter, but if it's going to save a child's life, yeah, do it in school by a nurse.
Sioux Falls schools have a protocol in place should opioids turn up in the building.
Anytime that staff would, potentially come into contact with any substance that they're not familiar with, they would want to make sure to reach out to their administrator in the building and their SRO and have them handling that using the proper precautions.
The Narcan in schools isn't just intended for students alone. It can be administered to anyone visiting campus who's showing signs of an overdose, even off school grounds.
It could be a parent that comes in that has an exposure to it, or it could be somebody that just happens to be in the area and we happen to be close. It's not uncommon for us to respond to things that are happening within our neighborhoods of their schools as well, because those things that happen in our neighborhood have a very real effect on what happens inside our schools as well.
Raising awareness of the danger of opioids, especially the potentially deadly effects of even small doses of fentanyl, is another important school strategy in preventing overdoses from claiming younger and younger victims.
We're always making sure that we are giving students information so that they can make good choices, and so we want to keep doing that.
Well, that is all the time we have for tonight, but this is only the beginning of our coverage on the opioid crisis. Tomorrow night at 8 o'clock Central Time, we'll bring you an hour-long special report. We'll show you the faces of addiction and introduce you to families they left behind. We'll also let you know about local resources and when it's time to get help. We've set up a special page on KELOLAND.com. Just click on Opioid Crisis on our homepage. And while you're there, you can also learn more about Emily's Hope. That is the fund in my daughter's name to help offset the cost of treatment through the Avera McKinnon Foundation. Thanks for joining us. Good night.